So, a silent side effect that people facing cancer don't always talk about is mental health. Are there any treatments or coping methods that you recommend for patients and care partners?
Yeah, so I would say I to get social work involved early on. I think there's also, it's silent because there's a lot of stigma around it. Is that, is this
Yes.
something that we should be talking about or not talking about, or I can handle it, that sort of thing. So I think I introduced our social worker very early to know that she is a resource for the patients, no matter how big or how small, just to try to get them used to that idea. What I would also say is just talking with as many people as possible.
Mhm.
As I'm sure you realize that the network and the community is small and everybody is willing to help each other out. So once you put yourself out there, you'll
Mhm.
realize that there are other resources out there and you're not alone in this journey. And what your cancer team offers you is different than what other patients who have gone through exactly what you've gone through can offer.
Mhm.
And so I know that there are other resources out there in terms of societies that connect other patients who have the same diagnosis. So I would say it's really just about education and talking and knowing that it's okay to talk about your diagnosis, and no matter what format that is, or if it's a little bit now and a little bit later, and also just normalizing it in the sense
Mhm.
of the feelings you have are valid and it's
Yeah.
normal. And it's, if you don't have those feelings, is actually when I get worried about patients, because
Mhm.
you're supposed to have certain reactions. I mean, you were a young patient and you were diagnosed with cancer. Like, that's not a trivial thing. So, and we're all here to help you and help the patients go through everything.